Chairman Barletta for holding this very important hearing on the opioid epidemic in Appalachia and how it is impacting adversely and severely the lives of our brothers and sisters in Appalachia. Since the formation of the Appalachian Regional Commission in 1965, Appalachia has made significant progress in executing its mission of addressing persistent poverty and economic despair. However, the progress made in attracting industry to Appalachia and reducing poverty has been threatened by the current opioid epidemic sweeping the nation. According to the Centers for Disease Control and Prevention, the CDC, drug overdoses are now a leading cause of death in the United States, resulting in approximately 52,000 deaths in 2015. 52,000 deaths in 2015, or 142 deaths every day. In Appalachia, the problem is even worse. In 2009, the mortality rate in the Appalachian region was 24% higher than the non-Appalachian United States. By 2016, the mortality rate was 37% higher than the rest of the nation. The opioid epidemic also happens to strike in the most devastating way to men and women between the prime working ages of 25 and 44. Although the mortality rate is lower in the Georgia counties in my congressional district covered by the ARC, I think there can be important lessons learned for the Southeast Crescent Regional Commission, another economic development commission that I introduced legislation reauthorizing earlier this year. This is a full-blown crisis that demands the attention of Congress. The high rates of substance abuse and mortality in Appalachia compared to the rest of the United States is a serious impediment to sustained economic growth. Employers are seeking a healthy workforce when making decisions about where they will locate their businesses. High rates of substance abuse and mortality make it difficult for employers to find and hire qualified candidates. The ARC, in its mission to promote economic development in the region, has understood the grave threat of opioid addiction to the economic viability of the region. In 2017, the ARC commissioned 2 reports that clearly outlined that men and women of prime working ages are beset with high rates of substance abuse and mortality. I support ARC's conclusion that increased access to treatment services, prevention, and overdose medications to address the opioid epidemic are necessary. I'm pleased that the approach to the opioid epidemic in all of ARC's commissioned reports discuss this problem in the context of it being a public health issue as much as it is a law enforcement issue. We must not repeat the mistakes of the past where drug abuse was over-criminalized as it was during the crack cocaine epidemic of the 1980s. The government's response to drugs in the 1980s did not have the effect of easing the problem, but instead only intensified the severity of the problem. Hopefully, we've learned some things from our past. Today, the comprehensive reports and testimony before this committee make clear that the genesis and driving force for this epidemic starts with the proliferation of prescription drugs. I am glad that we will have a former DEA official talk about how changes in the law and policy at DEA contributed to the explosion in prescription pills in Appalachia. There's no silver bullet to solve the opioid epidemic, but I look forward to hearing from today's witnesses on how a comprehensive, multifaceted approach can address this crisis. And with that, I yield back.
Thank you. Chair now recognizes the ranking member of the full